ஆல் இண்டியா ரேடியோ செய்திக்கதம்பம். சென்னை ஐஐடியில் நடைபெற்ற செய்தியாளர் சந்திப்பில் கோவிட் தொற்றால் பாதிக்கப்பட்டவர்களுக்கான இண்டோமெத்தசின் மருந்தின் பயன்பாடு குறித்து சிறுநீரகவியல் துறை இயக்குநர் டாக்டர் ராஜன் ரவிச்சந்திரன் பேசுகையில்,
Indomethacin. This is a very old drug, patented in 1965. A very powerful anti-inflammatory drug. So it was initially used, rather it is still being used in rheumatoid arthritis. Rheumatoid arthritis has severe inflammation of the joint. It is still useful in a number of inflammatory conditions. As nephrologists, we have used it in patients with the inflammation around the heart, what is called pericarditis. Now the interesting part is, it all happened in around March, April 2020 when the coronavirus epidemic broke. So what was found was that the disease is produced not directly by the virus. The virus has cytopathic effect, but more interestingly, the body's inflammatory defense, the inflammation was producing more problems. So the patients were having inflammation in the lungs, predominantly in the lungs, leading to reduced oxygen saturation, and then lots of deaths, and of course high fever, body pain, etc. So the inflammation was a hallmarker of this disease. So since we have used indomethacin for inflammation, and there is an interesting condition again, we have been using a drug called OKT3 for rejections in kidney transplantation. When we use this medicine OKT3, there is what is called a cytokine storm. So this cytokine storm is not recently described. It has been described several years back, almost more than 30 years back, where the patient, when you inject the medicine, he will get low oxygen saturation, blood pressure may drop, he becomes breathless, runs fever, has body ache. So this cytokine storm was known to us, and what we used to do was to give indomethacin prior to the OKT3 injection to control the cytokine storm. This has been published right in 1989. Considering all this, the effect of indomethacin as cytokine storm as well as its anti-inflammatory action, we started using it in COVID patients in April 2020. So what people are not aware is the antiviral action of indomethacin. So it's not just anti-inflammatory. Anti-inflammatory is very important. That's why I started it. Then when I looked up the literature, I found that it has antiviral action. In 2006, Amici had shown in the coronavirus 1 and 2 in the dogs that it produces an antiviral, severe, profound antiviral action. This has also been produced by others. So there is an antiviral action to that extent that this drug has been patented as a broad spectrum antiviral drug in the US. It has also been used for other viruses like cytomegalovirus, herpes virus, etc. So what is not known was this antiviral action. And there are reasons for it, because it inhibits what is called the prostaglandin E synthase and cathepsin L. These two are very important steps, and they prevent the virus from replicating. That's a very interesting mechanism, because the virus, even if it undergoes mutation, still this drug could be effective. So unlike other antiviral drugs, which the virus will become resistant after some time and will develop mutations, indomethacin is likely to work in variants also. This has been shown in Italy in 5 different variants in the laboratory that indomethacin still continues to work. Our own experience has been in 2020, 21 and 22, still the drug is quite effective in treating patients with COVID-19. So the antiviral action. The third important one is called the anti-bradykinin action. The anti-bradykinin action. Bradykinin is a substance which is responsible for this cough and body pain, what we call myalgia in patients with COVID. So this is the only drug which has this anti-bradykinin action. This is very interesting. All other painkillers or paracetamol, etc. do not have anti-bradykinin action. So that's why you will find when you start patients on indomethacin, there is a rapid improvement in clinical symptoms. To that extent that many of them in a day or two want to go back to their normal work. This has been our experience in all mild patients. So it's very effective symptomatically because it has an anti-bradykinin action. So 3 important actions. This is the one from the University of California, San Francisco, where they had seen the records, insurance records of patients who had received during the first outbreak about 244 patients had received indomethacin. Not even a single person required hospitalization. So the scientific basis behind the use of drug was discussed in this paper. In New York at the same time, April 2020, Jonathan Lobovic had treated 60 patients, and what he found again interestingly was that these patients improved symptomatically dramatically. So this was published in 2020. Again, subsequently, what I did was, we studied in a small series of patients. First, we took 17 patients who had different comorbidities. Old age, diabetes, blood pressure, obesity, kidney disease, etc. Different types of problems. These patients with mild COVID disease were given indomethacin, and the response was very good, and this has been published. Subsequently, we studied in 12 of the kidney transplant patients also, who showed similarly good recovery. So then, the point was, we should have a larger trial. That's where I got associated with IIT. Single doctor's experience has no meaning. So this has to be reciprocated, produced in a proper scientific trial. Who else other than the IIT who can be a scientific body who can help us? The first one, where we compared about 72 patients with those who had received paracetamol with indomethacin. It was a comparative study looking at difference was so enormous that none of the patients with indomethacin desaturated, whereas more than 25 patients in the paracetamol group desaturated. Again, so this was the initial study. So the objection that was raised at that time was that here it was not a randomized control trial. Here it was given, what we had done was given indomethacin to 70 patients, and we had compared with the records of patients who had received paracetamol. So there was some objection when we sent it to the government and various associations that it should be a proper randomized control trial. It was very difficult to conduct a trial, proper double-blind trial or something like that. We then organized the randomized control trial. That is the main topic for today. This has been published leading journal, Nature, which is one of the top journals in the scientific report this week, and that's why this press conference has been called. And steroid is non-specific. It's a broad spectrum anti-inflammatory drug. So it's not an antiviral action. See, it's very normally steroids are contraindicated in viral disease. You don't give corticosteroids in a virus disease because the virus will multiply faster. It lowers the body resistance. Because in this disease, inflammation has been responsible for the death, corticosteroids were used. So that's why the recommendation is not to start steroids who don't desaturate. So steroids is a very different drug, whereas indomethacin does not affect the body's resistance. It does not change the cell count. For example, the lymphocytes or other WBC cells are not affected by indomethacin at all. So it is only an anti-inflammatory and an antiviral drug. The antiviral also, it acts through the cellular mechanism, where it goes through the person's host cells. It inhibits this prostacyclin E. So this is cathepsin, which are very important for the virus. It doesn't directly act on the virus. So that's why we expect that even mutants will be susceptible to indomethacin. See, one of the breakthrough in treatment of COVID was from the UK trial. All of you know that steroid responsible by reducing by 50% of the patients required the oxygen landing up on ventilator. They didn't show that improved dramatically, but definitely steroids made the first breakthrough, which all over the world got publicized. Now steroids have a number of side effects. Steroid lepona, you can get blood clots, you can get high sugars, diabetes can happen, fungal infection, as you would have heard, mucormycosis, the fungus which infects nose and goes to the brain. All these complications are related to steroid therapy, including diabetes. Whereas in indomethacin, there is no long-term complications at all. It is going to have only short-term effects. Some of them can get a stomach pain because it can produce gastritis. That also we were giving along with pantoprazole, whatever pan and all. So many of them hardly had any side effects. So the side effect profile of indomethacin is very low. Only when you give it for a long period of time, you can have side effects. Whereas steroid have a very high side effect. See, very important difference is steroid lowers the body resistance. So because of that, you can catch other infections. If the patient is admitted in the hospital, he can catch urine infection, fungal infection, so many other things. Whereas indomethacin does not lower the body's resistance. It does not affect. It is specifically antiviral and anti-inflammatory. It is not lowering the body resistance. That way it is a superior drug to indomethacin. But we have even used, but steroids are very effective in some patients because inflammation is controlled very well by steroids. There are patients in whom we have used a combination of indomethacin and corticosteroids. So what we normally do is to start the patient on indomethacin. By chance, if he has multiple comorbidity condition and all, and the oxygen saturation level drops, we additionally can give steroids also. Both the drugs can be combined together also.
இத்துடன் இன்றைய செய்திக் கதம்பம் நிறைவு பெறுகிறது.